Hello everyone, my name is Dr. Marty Kotler, and I'm the president of Target Coding. Thank you for listening to this billing, coding, compliance, and documentation tip of the month. Today's topic is how to respond to a request for patient records. Now this request doesn't necessarily have to come from an insurance company. Typically that is the case. It's the most common type of a request for records is when it comes from an insurance carrier. But the request can be from a state board. A patient may have filed a complaint against you and now the state board is looking to see what's happening, so they may request to see your records. A request for records can come from or as a result of a malpractice situation. So regardless of why a request for records has been made to your office, it's typically an unsettling feeling. Even if you feel like your notes are really good and you've been doing a good job, it's still not fun. It's stressful for most offices. It's just something that you don't want to have to do, but there are many instances where you don't have a choice. You have to send in the information. So let's just go through a few of the things that you should do to prepare yourself. So just hopefully this never happens to you, but if it does, just put yourself in the shoes of a provider that has just been asked for records. You can get a letter from an insurance company requesting to see copies of exams, SOAP notes, financial records. It could be on 10, 15, 20 patients. Sometimes it's just for the exams. Sometimes it's just for the SOAP notes. Sometimes it'll be for the complete record on a patient from the very first day the patient ever came into your office, which could have been 5 years ago up through the present. So there's all different types of records requests. So let's just go through a few of the things that you should do. First, just stay calm. The most important thing to do is just stay calm. Just because you receive a request for records, it doesn't mean you did anything wrong. Now I know that might be hard to do, but just remember you may have not done anything wrong. So it's not worth getting too upset about. Speak to someone about this that has experience with this to help you, alleviate some of the stress. So the first thing I recommend, that's the first thing. The second thing I recommend you do is start checking the names of the patients that were listed in the letter you received from, let's say this is an insurance carrier request for records. Are these your patients? I've seen providers receive correspondence from insurance carriers that were not intended for them to review or to receive. So we all make mistakes, right? Insurance companies could make mistakes. I've seen it. You may have received a request for records and these people are not even your patients. So check the names. That's the first thing you want to do. Make sure, you're starting to get your house in order, so to speak. Next, pull the charts of these patients. Start to review them. Do the dates of service in your chart notes coincide with the dates of service in the letter? Again, I've seen this happen where an insurance company has asked a provider for notes on a particular patient. Well, that particular patient was a patient in this provider's office. However, the dates of service that the carrier was requesting, on these dates of service, the patient was not seen by the provider. So again, you just want to make sure everything is aligned. So let's assume that the names on the patients, the names on the letter are your patients, and the dates of service they're requesting, you have seen these patients on those dates of service. So, what should you do next? After your review of the chart, then start to ask yourself this question. Are you going to be able to gather all of the information that the insurance carrier requested by the request deadline? There may be a lot of information that you have to gather, and you may not be able to gather it in time. So take a look at it. See how voluminous this is going to be. See how long you think. Just make an evaluation of how long you think it's going to take to gather all the information. Typically, the carriers request for these patient charts, they want to see it within 30 days of the date on the letter that you received. So you may be able to do it, but most of the time it's not enough time. It may not be reasonable, especially if you want to seek advice on what to do. So what I recommend you do is call the carrier, request an additional 30 days to submit the information. 99% of the time they will give you an additional 30 days to gather the information. Now, if you're going to make this call to request an extension, you may now have the opportunity to speak to the lead investigator. Now, be careful with this conversation. Do not provide any information to the investigator that can hurt you. Now, at this point, I know there are some attorneys that may not recommend you speak to the investigator at all. However, I don't see anything wrong with speaking to the investigator for an extension, and I don't see anything wrong with you asking the investigator why you were chosen. Ask the investigator why you were chosen for this review. They may or may not want to tell you. Was it a random audit? Was it a targeted audit? Again, do not volunteer any information that could link you to any wrongdoing. So after copying all of the requested information, I typically recommend providing the carrier with a cover letter, or some people call it a treatment summary, for every patient. It's just a nice review, especially if your soap notes look a little sloppy. It may be a great opportunity for you to put together a treatment summary. A summary of the care you provided helps the carrier understand your clinical approach. Now remember, these treatment summaries are typically not required, but if you think your soap notes and your treatment plans are not sufficient, they might not be legible, so you may want to spend the time creating a treatment summary. Now it could be time consuming, so be aware of that. Now if you would like a sample treatment summary, we have one. We'd be happy to get it to you. All you need to do is send an email. Send an email to info@targetcoding.com and say, hey, I just listened to your YouTube video on records requests. Can you please send me that sample treatment summary? We'll be happy to send it to you. Now, many insurance carriers, actually most carriers including Medicare, they post their chiropractic position statements. Sometimes they're called medical policies or guidelines on chiropractic services. I recommend you take a look at these policies from all the carriers you bill. You'll see that some of them will actually tell you what they're looking for. It's a nice way to get a handle on what are they looking for. For example, there are some carriers that say they want to see, in the documentation, they want to see that the patient has had some improvement within the first 2 to 4 weeks of care. So you just may not be paying attention to that, you may not be aware of it, and you've provided the patient with 4, 6, 8 weeks of care, and not once did you mention that the patient has had improvement. Your re-exam doesn't mention that the patient has improved. Well, they might say, well, if the patient has not improved after 2 weeks of care, we don't feel that the care is medically necessary, and now you have this battle that's going to occur. So check out those position statements. They're typically easy to find. Another thing that I would recommend you be aware of and look into is learn as much as possible about establishing medical necessity. Nowadays, insurance companies, they're always looking to deny claims based on medical necessity. So make sure you understand what medical necessity is. Make sure you understand how to properly link your codes, how to properly point your diagnosis codes. So CPT ICD-9 code linking and CPT ICD-9 code pointing is very important. Make sure you're setting goals in your treatment plans. Now, some chiropractors may want to attain the service of an attorney as soon as they receive any type of records request from an insurance company. Again, you may want to get an attorney as soon as you get that letter. I don't see any downside to doing this. There's nothing wrong with speaking to an attorney about your situation. But again, stay calm. After you submit the requested information, remember, no news is good news. You may never hear from them again. So I want to thank you for listening to this quick tip of the month. And here's our contact information. Our email address is info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. We offer membership services, customizable forms, letters, templates, online trainings. Many of them have continuing education credits, DVDs, workbooks, webinars, seminars, and much more. Again, thank you for attending this coding, billing, documentation, and compliance tip of the month. Thank you. Bye-bye.